Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, February the 24th. We are in week 51 of the COVID pandemic here in Montgomery County. And today I'm joined by my colleague, Commissioner Ken Lawrence. I'm happy to report that we are back on track with our vaccine clinics after the very difficult weather situation that we had at the end of last week and the beginning of this week. We were fortunate here in Montgomery County to have received all necessary second doses of Moderna vaccine for this week. Next week will be a transition week as we begin to offer second doses at Norristown High School and go back to Montgomery County Community College for first doses. So please pay close attention to the location to which you are directed. Up until this point, we have been giving the Moderna vaccine at our clinics. Due to Moderna supply issues, we are starting to distribute the Pfizer vaccine for first doses on Thursday, tomorrow, February the 25th. Moderna's second dose has a minimum of a 28-day interval, and the Pfizer second dose has a minimum of a 21-day interval before we give that second dose. However, both vaccines are approved for second doses up to 42 days after the first dose. The county wants to be able to say yes to any vaccine offered to us. Consequently, the Montgomery County Office of Public Health will be bringing all people back for their second dose, regardless of which vaccine they received, using a 28-day interval, so that we don't have some intervals needing to come back in 3 weeks and other individuals needing to come back in 4 weeks. There's no medical reason that we cannot 8 days, and doing this will maximize the county's ability to accept any of the vaccines available that are offered to us. This will also maximize our ability to administer daily first doses. I'm very pleased to announce that our pre-registration for the COVID-19 vaccine is now available by phone through our COVID-19 hotline. Our Office of Senior Services has implemented this service for people in the county who need support pre-registering for vaccine appointments by phone. To pre-register for the vaccine by phone, you can call the Montgomery County COVID-19 hotline at 833-875-3967 and let the agent know you need support in pre-registering for a vaccine appointment. Once a registrant's information is will be placed in line to receive an appointment. When we have vaccine for you, a volunteer will call pre-registrants back and make that appointment reservation over the phone. There's no need for callers to have a valid email address or to have internet access. This new service is staffed by volunteers, and I am so grateful to everyone who has volunteered to provide this service to our residents. To date, we have over 160 volunteers who have been screened, background checked, and trained to support vaccine registration. To inquire about volunteering, please visit the Montgomery County Office of Senior Services website at montcopa.org/senior services. And that's all one word, senior services. To help manage the call services, the Office of Senior Services is partnering with a technology provider, Montgomery. Their technology will route calls to volunteers and allow volunteers to register callers for vaccine appointments on their behalf while masking both the volunteers and the client's personal contact information. After thorough training and onboarding, we are so pleased to have this program up and running. Our goal is to be able to get the vaccine to anyone who wants it once our supply increases. Since pre-registration by phone is a volunteer-run operation, it is staffed from 8 a.m. to 4 p.m. Monday through Friday. And again, that number is 833-875-3967. The Montgomery County COVID-19 hotline is operational 6 days a week, Monday through Saturday from 8 a.m. to 8 p.m. Live operators will be able to answer your COVID-19 questions. In addition, the hotline has language line support for over 100 different languages. We encourage people to call this number or to email covid19@moncopa.org with general questions about COVID-19 and the vaccine. Please note the hotline cannot provide updates or timelines on vaccine pre-registration or troubleshoot issues with vaccine appointments. It's only for general information and phone pre-registration. For those of you who've already pre-registered on our site, we will be sending weekly emails to keep you updated on our vaccination progress and what you can expect when it's your turn. As of 9:30 this morning, we have 172,046 people pre-registered. At this time, and depending upon when you registered, it may take up to 12 weeks before you hear back scheduling an appointment. We now have information on our website to give those of you who have pre-registered some idea of where you are in the line. On our vaccine page, there's now a link next to a blue flag that says Status of Vaccine Registrants. This link will take you to a chart that lists how many individuals pre-registered each day beginning January the 12th. If you know the date that you registered, you can see how many people are ahead of you. Currently, we are registering people for vaccine appointments who registered on or before January the 13th. Please note that we had over 30,000 people pre-register on January the 13th. So it will take us some time to move through this day. However, we are also finding that a number of these individuals have already received vaccine. So we are cleaning up the list as we go. Additionally, we're moving to a system of sorting individuals by age within a given day and prioritizing those who are 75 years of age and older from any given day. So no one will lose their place in the line, but within a given day, those that are 75 years of age and older will be the first group to get vaccine appointments, and then those that are under 75 will get the next set of vaccine appointments. The website also now displays a running total of how many doses of vaccine we have received and how many doses we have given, and that is being updated weekly. To get to the vaccine page, go to montcopa.org/COVID-19 and click on the vaccine information button at the top of the page. As a reminder, if you would like to be vaccinated and have not yet pre-registered with the county, anyone 65 and older and those aged 16 to 64 with specific underlying medical conditions are encouraged to pre-register to receive the vaccine from the Montgomery County Office of Public Health on our website. And again, that's montcopa.org/COVID-19 and click on the vaccine information button at the top of the page. I remain encouraged by the enthusiasm that so many people have to be vaccinated. And as I continue to ask you for your patience, I want to share a graphic with you to give you the sense of where we are in this process. So we've changed the graphic a little bit this week, and I'll explain it as we go through. So first of all, you'll see on the upper row, the first doses that the Montgomery County Office of Public Health has received directly. So that's 31,080. As of the end of the day yesterday, we've administered 24,565 of those doses. So we have about 6,500 first doses remaining. We are back to a throughput of about 1,000 doses a day. And so we have 5 to 7 days remaining before our next shipment. And by the time the next shipment comes, we should be at about 0. As I mentioned earlier, we're booking appointments for people who pre-registered on and before January 13th. And again, just a reminder that we had 30,000 people register on January the 13th. So it is going to take us some time to get through that. Now, in terms of countywide vaccination status, we now have 76,926 individuals partially vaccinated. That means they've gotten their first dose. And 33,706 individuals fully vaccinated, meaning they've gotten both doses. And this is data that we get from the Pennsylvania Department of Health, and this is today's update. So this does include what PADOH has through this. And then you can see there, for instance, the partially covered represents 9.26% of our entire population. But since we don't have the ability to vaccinate anyone under the age of 16, we've also calculated this as a percentage of those who we know from the census data are 16 and up. So when we look at it that way, we're at 11.8% of our population, and then 5% that have been fully covered. So we're making some progress. Now, we have some new data for you today over on the right. This is county-wide race and ethnicity data. We have begun to be provided with this data from the Pennsylvania Department of Health for all Montgomery County individuals that have been vaccinated, regardless of where they were vaccinated. I want to make a plea for everyone to please strongly consider identifying their race and ethnicity. As you can see, we do not have racial data for about 30% of Montgomery County residents that have been vaccinated, and we do not have ethnic data for about 40% of Montgomery County residents that have been vaccinated. Having this data is critical to our efforts to ensure an equitable distribution of vaccine to all members of our community. So let me just walk you through this graph. We have the race or ethnicity on the left, the percent of the total Montgomery County population that this particular race or ethnicity makes up according to the census, and then the percent of the number of people that have been vaccinated that identify as that race or ethnicity. So you can see, for example, that in the Black or African American community, it is 9.6% of our total county population. But when we look at the percent of individuals that have been vaccinated, that is only 4.2% of the people that have been vaccinated. But again, I remind you that we've got about 30% of individuals that did not identify their race. So again, I urge everyone to please help us, help our whole community by identifying yourself as you feel comfortable, and that will help us make sure that we get vaccine everywhere that it needs to be. Toward this end, beginning next week, the County Department of Public Safety, under the direction of Dr. Al Wong, will begin taking vaccine to our most vulnerable elderly residents who would otherwise not be able to come to a mass vaccination site. Now, you know, periodically we've been sharing with you information about outbreaks around the county. And we do this in an effort just to remind everyone that we still have a lot of vaccine in our midst. Today, I want to share some information with you about a recent cheerleading tournament that took place in the middle of February. At this event, there were 55 people at a time inside. My team is not sure of the total number of people that participated, but we do know that there were 14 cheer teams in total. So far, we have 7 teams that have positive cases. We are at least 27 individuals across those 7 teams, and those individuals are from multiple counties, including Montgomery County. I raised this particular event up because while the facility did have a health and safety plan, they had not submitted a specific COVID-19 mitigation plan to our Office of Public Health. And this is just a good reminder that we want to urge any facility considering an event or gathering to please reach out to the Office of Public Health, even if your gathering is within the allowed number of attendees for that space. The Office of Public Health will work with you to make your event or gathering as safe as possible. We are starting to receive questions from individuals who've been vaccinated, wondering if they must continue to observe the current quarantine requirements for individuals who travel outside of the Commonwealth. This question has been asked to Pennsylvania Department of Health, but while PADOH reviews this issue, they have reiterated that the current travel quarantine guidance still holds regardless of your vaccination status. And that information can be found on the Pennsylvania Department of Health's website. So moving on to our regular update, since the February 17th press briefing, we've had 837 new cases of COVID-19 reported in Montgomery County for the dates inclusive of Wednesday, February 17th through Tuesday, February the 23rd. This is a daily average of 119.6 cases and brings us to a total of 46,199. These positive cases are a result of a positive test for the virus, not from an antibody test. 30 of these were from long-term care facilities. 2 of these were from the Montgomery County Correctional Facility. 1 was from another congregate setting, and 804 were from our community. These positive individuals are from 58 municipalities, and as you know, all 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 1-year-old to 95 years old, and as always, you can check our maps at montcopa.org/COVID-19 for updated information. Today we have 403 females, 432 males, and 2 unknown. I am sorry to confirm that 19 additional Montgomery County residents have lost their life to COVID-19. This brings us to a total of 1,200 deaths confirmed positive from COVID-19. These individuals ranged in age from 40 to 97 years old. 15 died at a hospital, 2 at a long-term care facility, 2 in a private residence. Overall, we now have 608 females and 592 males who have lost their lives to COVID-19. They have ranged in age from 25 years old to 106 years old. The racial breakdown of this group as we have it: 2 American Indian or Alaska Native, 34 Asian, 7 Asian Indian, 5 Asian Korean, 140 African American or Black, 614 white, and 398 unknown. At the correctional facility, the situation remains stable. All inmates that have tested positive for COVID-19 are in isolation and stable without symptoms. Routine antigen testing continues for all correctional officers. Our positivity rate has continued its downward trend this week. Our 14-day average positivity rate is down to 6.12% as of Thursday, February the 18th, compared with 6.72% as of Thursday, February the 11th. So this is, of course, wonderful news. As a reminder, on this graph, the orange line is the number of daily PCR tests performed, and the blue line is the 14-day running average of our PCR positivity rate. As a reminder, a positivity rate below 5% is considered suppression of the virus. This next graph shows our daily positivity rates for January 22nd through February the 18th. And you can see that we did fall below 5% on 2 of those days, but we got it awfully close on some recent days. So very much hoping that within the next 4 to 6 weeks, we will be back under that 5% suppression level. Prior to these dates, the last date that we were below 5% was November the 4th. So we've been high for a long time. Our hospitalizations continue to remain high, but have improved slightly since last Wednesday. Today, we're at 154 individuals with COVID-19 hospitalized in the Montgomery County Hospital. This has decreased from 162 last week. 17% or 26 of these individuals are requiring a ventilator. So just a reminder that our hospitals do remain quite busy. To put these numbers in some context, on October the 1st, there were only 24 patients hospitalized with COVID-19 in a Montgomery County hospital. In terms of testing, for the 14-day period ending February 18th, 34,374 Montgomery County residents were tested, which is a decrease of 4,235 people tested compared with the 14-day period ending February the 11th. And you can see on our date tested graph that these numbers do all continue to move in the right direction. Give Todd a second chance here to get that graph up. There we go. So as a reminder, the gray bars are the number of positive cases on any given day. The red is the 7-day average of all cases, including those from long-term care facilities and other congregate locations. And the pink is the 14-day average of total cases. The dark blue is a 7-day average of cases that are only from the community. And the light blue is the 14-day average of community-only cases. The orange and yellow lines at the bottom are from our long-term care facility. So you can see that we are moving in the right direction steadily, and we are finally lower than we were at our peak in the spring. But it has taken many, many weeks to get there from our fall surge. Next, we'll zoom in to just a tighter view of the last couple of months. You can see happily that both our 7 and 14-day averages are moving downward. But I do want to just remind everyone that social gatherings and activities around the many winter holidays really had a huge impact on this county. And we could continue to see that again if people choose to participate in social gatherings. So please, please do be careful. We continue to have good availability of testing. And as always, I want to urge anyone who wants or needs to be tested to get tested. All 6 of our testing sites are open Monday through Friday with varying hours each day. Just one amendment to that for this week, our Green Lane and Pottstown sites are closed this week, but they will be back open next week. You can register online to make an appointment to be tested on the day that you would like to be tested by going to www.montco.org//COVID-19 and click on the County Testing Information button. Online appointments open at 7 a.m. on the day that you would like to be tested, or you can register by phone by calling 610-970-2937, and you can register by phone beginning at 8:30 in the morning on the day that you would like to be tested. And as a reminder, we do have language line available by phone. So a couple of announcements for tonight. We continue to host virtual COVID-19 town halls to answer your questions and concerns about the vaccine. And everyone is welcome at any of our town halls. Tonight, we're hosting a COVID-19 vaccine virtual town hall with the Hindu community at 7:30 p.m. Registration is available at montcopa.org/register. And then the next town hall will be next Wednesday, March the 3rd at 7 p.m. For this town hall, we're teaming up with the Bucksmont Collaborative, the Tri-County Community Network, the Interagency Council of Norristown, and the Montgomery County Immunization Coalition. And as a reminder, there's no cost to attend any of these town halls. They're open to any member of our community that would like to attend. And for next week's town hall, it's a slightly different registration. It's montcopa.org/town hall, all one word. If you're unable to make the specific time or date of these town halls, we encourage you to go ahead and register, and then you will be emailed a link to the recording of that town hall once that town hall is completed. So we encourage everyone to get educated and get your questions answered by watching one of these town halls. And with that, I will turn over to Commissioner Lawrence.
All right, thank you, Val. I have 2 announcements today. First, I'm going to share information about the Montco Strong 2021 Hospitality Industry Recovery Program. In 2019, the tourism and hospitality industry accounted for approximately 4% of all jobs in Montgomery County. We know with the limitations and mitigation efforts in 2020 on traveling and business and social and gatherings, that the hospitality industry has been one of the hardest hit sectors during the pandemic. Today, we are announcing that the hospitality industry businesses negatively impacted by COVID-19 can now apply for up to $50,000 in grant funding through the Monco Strong 2021 Hospitality Industry Recovery Program. Montgomery County has received approximately $9.4 million in state funding to provide grants to eligible businesses. Grant awards will be in increments from $5,000 up to $50,000. The eligibility, application requirements, and program design were all developed from Senate Bill 109, known as Act 1 of 2021. Eligible businesses must have their primary business activity in North American Industry Classification subsector 721, which is accommodations, or subsector 722, which is food services and drinking places. The application window will open at noon on Friday, March 12th. However, we are strongly urging interested applicants to review the program guidelines and facts in advance to ensure eligibility and to prepare to apply when the application window opens. Program guidelines and instructions will be available in English, Spanish, and Korean. This is not a first-come, first-served program. Grants will be awarded on a rolling basis, and the application window will remain open until grant funds are fully allocated. This program is being jointly administered by the Montgomery County Commerce Department and the Redevelopment Authority of Montgomery County. Questions regarding this program should be submitted through the Commerce Department's assistance request form on their website at www.montcopa.org/commerce, and you can find more information about the program there as well. Due to the large amount of expected applications, feedback on individual applications will not be provided. And now I just want to share some resources for mental health, as we have on occasion during this. As Val mentioned, we are approaching 1 year of CDC guidelines, physical distancing from neighbors and friends and family members outside of our household to reduce the spread of COVID-19. There's been no handshakes, no hugs, no gatherings, working from home, going to school from home, all while trying to balance family needs. As a result, we know that many are experiencing a greater and greater sense of isolation, loneliness, and of being overwhelmed. And even as the vaccine program has begun to roll out nationwide, there's been increased anxiety as people want to be vaccinated. And our new normal still doesn't feel normal. Adding to our concerns is the fear of becoming infected. Many of us are dealing with economic struggles and inconsistent messaging about the virus, vaccines, and when this pandemic may end. We want Montgomery residents to know that we care about you, and there are several resources available if you are struggling emotionally or in crisis. The state of Pennsylvania's mental health support line, Warm Line, will connect you with a free crisis counselor and can be reached toll-free at 1-855-284-2494. And the Montgomery County Mobile Crisis Support is available 24/7 for anyone experiencing depression or suicidal thoughts, and also provides peer and teen support services. And you can call 855-634-4673 toll-free, or visit www.accessservices.org for more information. And while we are still asking everyone not to gather and to remain physically distant from individuals outside of their household and to work from home if possible, we do encourage you to stay in touch with your family and friends, coworkers, and loved ones in other safer ways. Whether it's Zoom, FaceTime, Skype, or just a plain old phone call, please reach out to someone just to say hi or to check in to see how they were doing. It will be good for them, and it will be good for you too. And that concludes my announcements, Val.
Thank you, Ken. So with that, I'll just remind everyone that our next briefing will be Wednesday, March the 3rd at 1:30 p.m. and happy to take any questions.
Thanks, Commissioner. Just as a reminder to our reporters, we have a 3-question per reporter limit this afternoon. We'll start with Todd Shepard from Broad and Liberty.
Commissioners, as always, thanks for making yourselves available in this format. Lately, there's been increased talk about the the possibility or the need of a single vaccine registry through the state. For example, I think there's legislation being considered in both chambers of the General Assembly now, and last night the Allegheny Council voted unanimously to support the creation of a single vaccine registry like this. Does the Montgomery County Council have a stance on the need for a single vaccine registry?
We have not taken any official stance on the need for a centralized vaccine registry. However, obviously, it would make it much easier for our constituents if such a registry existed. I do want to point out, though, that on the technology that would be required to create such a registry is pretty complicated in terms of actually matching those individuals to a specific appointment. But if that technological problem can be solved, then obviously it would make it so much easier for our constituents, and I would certainly support that.
I would absolutely support that. One of the things that people find very confusing and still don't understand is if they are on our pre-registry, they're not going to be contacted by a pharmacy or other things. And we're also finding people now who have been vaccinated, but they're still on our list. So if it could be worked out, yes, I would strongly support a central registry for vaccine.
And just as a quick follow-up to that, some of the people that have voiced opposition to this point, they've said, well, it will take too long. But given that there are new strains emerging, and a lot of things in the COVID crisis have gone beyond what our initial time limits that we thought originally. Do you think the vaccine registry might still be helpful, even if it were only to come into creation, 4 months or 6 months down the road? Would it still be helpful at that point, or is it something that has to be created within the next 2 to 3 weeks?
Well, I wish I had a perfect crystal ball, which I would need to answer that question. I do think that we'll be vaccinating people for some time. And so I think if such a registry could be created, it would be helpful, even if it were a few months from now. And I think there's a larger point here, which is if the IT infrastructure could be created to support such a registry, then it would exist. And even if it's not perfectly timed for this particular situation, it could be used for lots of things. It could be used to help connect people to flu vaccines every year. Or, we don't know yet. It might be that people have to get a regular booster of COVID vaccine. And so to create that infrastructure would be helpful, I think, not just today, but for the future.
Thank you. No other questions for me.
Next, we'll go to Deanna Durante from NBC 10.
Hello. So last week on the briefing, I asked you about school guidelines, and you said your team was reviewing them. Since then, Delaware County, Chester County have come out and told districts to go ahead and start planning that if you need to drop the 6-foot space to get more kids into school, go ahead and do it. Obviously not a free-for-all to put kids next to each other, but what is Montgomery County doing at this point? Because many of the school districts say that they're just awaiting a little more guidance and a little reduction from all of you to try and get more kids in the classroom.
Our guidance has been clear and unchanging for months now, which is that we follow the Pennsylvania Department of Education and the Pennsylvania Department of Health guidelines, which say that schools should keep children 6 feet apart where feasible. And I believe the new CDC guidelines say children should be 6 feet apart to the extent possible. So as we have shared with our school districts, and we talk about this every week, schools are able to put their children closer than 6 feet together. And there are some schools in Montgomery County that are doing that. And the decision that has to be made is really the risk tolerance in that community. So if children are closer together than 6 feet, then the number of children that will need to quarantine is likely to be higher, because if there is a positive student, any student that is within 6 feet of that student will need to quarantine. If the students are all at least 6 feet apart, then no one would have to quarantine. So that's a decision. Some school districts are comfortable with that and they've moved forward, and others have not. So our guidance remains the same. If the Pennsylvania Department of Education and Pennsylvania Department of Health change their guidance in response to anything new that the CDC has said, we will go along with that. Now, what is going to be happening soon, I hope, is that the weather will be getting warmer, and you saw our numbers are coming down. And so I think that there will be the possibility to move more things outdoors. Maybe they can move lunchtime outdoors, do some things like that that would reduce the risk. And of course, as our numbers continue to come down, there is less virus in our community. And so the chances of there being a positive case in a school will also slowly start to come down. So these are all the factors that each individual school board has to consider. I just want to remind you that while the County Office of Public Health can ask schools to close or require schools to close, we cannot make anyone open. And these decisions about opening and about distances within school classrooms is at the level of the school's elected school board.
All right, thank you. If anybody else has more than 3 questions, I'll give them my other 2.
Doesn't work that way, Deanna.
Well, then I have one for you, Commissioner Lawrence. So here we go then. Earlier this week, many of us in the county received the ballot updated applications, and I was talking with someone in the county about sending it in. And so I wanted to see what the preference is. Do you want people to utilize the U.S. mail to get those ballot applications in if they want to continue to utilize mail-in ballots? Or what is your message to voters who are getting those in the mail?
We would actually strongly prefer that people do it online if possible. That way we don't have to do the data entry, so there's less of a chance that someone mistakes it. So if you can do it online, we would encourage people to do that. But if people want to use the postal service, we will receive it and we will get it in.
All right, then. I still have one left if anybody wants it.
Next, we'll go to Jim Millward from KYW.
As you look at case counts and where we are and where we've come from, just kind of your general thoughts as far as is this seasonal? What you expect to kind of happen as we go forward, or are you worried that the weather gets nice, people go outside and start hanging out together? Just kind of what are you thinking looking forward?
Well, I'm cautiously optimistic. It's been great to see such a steady decline in our numbers, even though we do know that we have that UK variant in our midst. And I know across the Commonwealth, there's been an increase in the number of individuals identified who have that more contagious UK variant. So I just have to be mindful of that. But we are seeing steady declines in our numbers. Our numbers are still quite high, though. I mean, if you look at that graph compared to where we were all summer and well into the fall, we have a long way to go to get down to those kinds of numbers. So while we're in a better place than we were 6 weeks ago, we're by no means through this yet. But I'm optimistic. We're vaccinating people every single day, and the weather is going to become warmer, which will allow people to go outside. And we also know that the virus is a little bit less transmissible in warm, humid air. So everything is going in the right direction at this point. And my hope is that these more contagious variants don't take hold here in any substantive way, and that we're able to get enough people vaccinated and people are able to get outdoors soon enough that we'll stay ahead of it. But I do just want to remind people, and that's why I mentioned that outbreak earlier today, indoor gatherings remain high risk. We still have a fair amount of virus in our community, not as much as we did a few weeks ago, but there's still an awful lot out there. So people need to continue to wear their masks, watch their distance, and wash their hands.
You've talked recently in recent weeks about rapid tests in schools. Do you have any update on that? I know some school districts have been hesitant out of concerns of specificity or false positives or those kind of things. Do you have an update on schools that have used it and how it's worked?
So we have, I believe it's 6 school districts that have fully implemented a surveillance program for their teachers using rapid antigen tests. And these schools, for the most part, are testing teachers and other staff once a week. And then they do have some tests at their buildings so that if someone becomes ill during the day, and that could be a student or a teacher, that they can be tested for COVID-19. These are antigen tests, and so you're right, they do have a rate of false positives, meaning that a person tests positive even though they don't actually have coronavirus. And so each of the districts now has a different rapid PCR test that is a very accurate test. So if anyone tests positive on the antigen test, they either get this rapid PCR test performed, or they go to one of our county testing locations and they get a county administered test, but we do confirm any rapid antigen tests. So from the people that I've talked to, they found it to be helpful. I have actually talked to a couple of teachers from schools that are participating in this program, and they all tell me the same thing, that it makes them feel a little safer to know they're a positive or negative, and they've all been negative so far, thankfully, their negative status, particularly when they go home at the end of the day to their families. So again, it's just, we're trying to give our schools every tool that we can to help make the teachers and the staff feel as safe as possible, and continue to bring children back to the schools and support our local school boards that are making those decisions.
And I apologize for using all 3 of my questions, unlike my predecessors. But can you talk about how those tests are still? I assume there's still a role for those, even though there's a vaccine. Testing in general, and also the surveillance tests in schools.
Yeah, well, I think there'll be a role for this testing for quite a while. I mean, if you do the math on the number of vaccines that we're getting every week and the number of people in this county, it's going to be months before we get to the 75% or 80% of people that we need to have vaccinated to reach some level of herd immunity. So, and what also goes along with that is that we still don't have the ability to vaccinate anyone who's younger than 16. And so I do believe that there'll be a role for rapid testing for a while to come.
Our next reporter is Krista Shoemaker from the Intelligencer. Okay, we will go to Carl Hassler from the Pottstown Mercury.
Good afternoon, commissioners. Did I hear you correctly that you said beginning next week, you're going to have a program where you're going to take vaccine to vulnerable people who can't make it to one of the clinics?
That's correct. Dr. Wong with some paramedics with some of our most vulnerable elderly locations, and to begin to take vaccine to them.
How will they be identified?
So we're starting with the list of affordable housing for seniors that exists within Montgomery County. There are about, I think, 30 of those. Altogether, maybe it's a little more than 30. It represents a little over 3,000 housing units. And so that's where we're going to start. Many of these individuals don't have good transportation or have other barriers to getting to a mass vaccination site. So that's where we're going to start.
And you will actually go out to their homes and give the vaccines there?
So most of these, really all of these, are either apartment buildings or units that are grouped together, within a like a block or 2-block location. So we'll be going to those locations, and with the vaccine, people will need to be registered, just like anybody else, and they'll need to be in the 1A category, and we will administer the vaccine there. So in most cases, it will be in a building that has a community room or something like that.
Okay, thank you.
Mm-hmm.
Next, we'll go to Jeff Cole from Fox 29.
Thank you, Dr. Arkush, for you. It looks like the Johnson & Johnson vaccine is going to get possibly final approval Friday. Speak about the county's interest in that vaccine, and do you know what you'll get from it, or what can you tell us about that at this point?
Well, that was certainly welcome news to read in the paper this morning. I want as many tools in our toolbox as we can possibly get. So look forward to having a third vaccine on our list, and a vaccine that requires only a single dose. I do not know yet what we will get, or if we will get any of that vaccine, or what the timing might be on that. So I look forward to hearing from PADOH what that looks like. Not only is it a single dose, its storage requirements are much simpler. It can be stored in a normal refrigerator for some period of time. And I do think that these single dose vaccines will be particularly helpful for certain populations where it may be difficult for an individual, for whatever reason, to come back for a second dose. So we'll probably be prioritizing some of those populations in the early days if we are able to get some of that vaccine.
Just two more. Who are the populations that are it's more difficult for them to come back for a second dose? Older folks or people, disabled folks?
So it would be, I think, a combination of older individuals, like some of the individuals that I referenced earlier, or we have a number of individuals in the county who are experiencing homelessness. And we've already gotten outreach from all of our Code Blue shelters, as well as our CHOC, our 24/7 shelter, that many of the individuals that are there would greatly appreciate being vaccinated. And for the safety of our community, it would make a lot of sense to vaccinate them. So we'll be looking at all of those populations.
Final question I have for you. The governor has said again recently that Pennsylvania needs to do better with distribution, needs to do better in terms of equity. Do you see any signs that Pennsylvania is doing better? And once again, offer your recommendations as to how they could from your large county perspective.
I have to be totally honest, I haven't been paying that much attention to the rest of the Commonwealth. I've been very focused right here at home and making sure that Montgomery County is getting every dose that we get into an arm as quickly as possible. So, whenever anybody calls and asks, we are happy to share what we've been doing. And of course, we always welcome ideas for how we could do what we're doing better. So, I just think we have to work together to all achieve the same goal, which is to get every vaccine that comes into the state into the appropriate arm as quickly as possible.
I'm sorry, but don't you believe that, I think you may have said in the past that these mega vaccination sites that New Jersey has put in play, 6 of them, do you believe they would work here? Do you think it's advantageous to do that here?
Well, what the county's been doing is sites that do 1,000 people a day, and that's been working very, very effectively for us. We are hopeful that we'll have enough vaccine soon to open up a third site. Those mega sites work well for people who can get to the mega sites. They have the transportation available to them to get there. So I think they're great if the population can get there. We've taken a little bit different approach, which is to have pretty big sites, 1,000 people a day, but we're trying to spread them out to different locations around the county to maximize people's availability to get there. We do hear that Philadelphia is likely to get a FEMA site that will be able to vaccinate 6,000 people a day. I believe that is only going to be for residents of Philadelphia. But again, I think they're putting it in a place with good public transportation and all of that so that people can get there. So as long as we take that into account, look, the more vaccine, the better in terms of getting people vaccinated.
Thank you. Thanks for your time.
Our final reporter today will be Tony Wood from the Philadelphia Inquirer.
Yes, hi. Just two unrelated things. Aside from the racial identification issues, You think you could identify one factor that could explain the racial disparity in the vaccination rate?
You know, I can only comment on what I've heard from members in our community, and it's complicated. You know, I think that there's definitely hesitancy from a number of different communities. There are, to some extent, accessibility issues in terms of people having transportation or other issues or being able to get off work, you know, things like that to be able to get to the vaccines when they're being offered. And I think we all have an important role to play here to continue to educate our communities about these vaccines and what's available and how to get it. We've been doing at this point a minimum of weekly town halls, and sometimes we do more than one in a week, just trying to get information out to different communities. We did one last week that was simultaneously translated into Spanish. So again, just trying to understand where the needs are and how we can get the information out to everyone to make sure that they understand what these vaccines are about and what it would mean for them if they chose to take it.
Okay, and the other question I had is, do you have any further evidence of the United Kingdom variant in the county?
Any what? I'm sorry.
Any further evidence of the spread of that UK variant in the county?
Yeah, nothing official. We have only been officially notified of the 4 cases that I announced. I think it was a week ago or maybe 2 weeks ago now. Although our contact tracing did show, you know, that we had some individuals who caught it from them, and none of those people had traveled. So, you know, presumably it's here, but we have not gotten any additional official notification.
Okay, thank you.
Thank you.
That concludes our questions for today.
Thank you, everyone. We'll see you next week.